If you're a new parent or about to become one, first of all, congratulations. This is such an exciting time. But let's be real, it can also be a little overwhelming. You've brought this tiny human home, and now you're wondering, what on earth do I do? Don't worry, you've got this, and I'm here to help. Today, we're breaking down the absolute essentials of newborn care and routines. We'll cover everything from feeding and sleeping to bathing and bonding, making your first few weeks as smooth as possible. So grab a cup of coffee, or let's be honest, reheat it for the third time, and let's dive into the world of baby care basics. First up, let's talk about the big one, feeding. Whether you choose breastfeeding, formula feeding, or a combination of both, the most important thing is that your baby is fed and growing. Newborns have tiny tummies, about the size of a cherry at first, so they need to eat frequently. We're talking every 2 to 3 hours, around the clock. Yes, that includes nighttime. This is called on-demand feeding. Instead of watching the clock, watch your baby for hunger cues. They'll start smacking their lips, rooting around for your breast or a bottle, or bringing their hands to their mouth. Crying is actually a late hunger sign, so try to catch those earlier cues to keep things calm. Remember, every baby is different. Some are speedy eaters, while others like to take their time. Just follow their lead. And don't forget to burp your baby during and after each feeding to release any trapped air and prevent discomfort. A gentle pat on the back while they're over your shoulder usually does the trick. All right, let's move on to the magical and sometimes elusive world of newborn sleep. Here's the deal. Newborns sleep a lot, up to 16 to 18 hours a day. But, and it's a big but, they do it in short bursts of 2 to 4 hours at a time. This is because they need to wake up frequently to eat. One of the biggest challenges for new parents is the classic day-night confusion. Your baby might be wide awake at 2 a.m. and snoozing all afternoon. To help them sort it out, keep things bright and active during the day. Open the curtains, don't worry about household noises, and interact with them. At night, do the opposite. Keep the lights dim, speak in a quiet, soothing voice, and make feedings all business, no playtime. This helps signal to their developing internal clock that nighttime is for rest. A consistent, simple bedtime routine, even at this early stage, can work wonders. A warm bath, a gentle massage, a final feeding, and a lullaby can signal that it's time to wind down. Now, let's talk about creating a safe sleep environment. This is non-negotiable. The American Academy of Pediatrics recommends the ABCs of safe sleep: alone, on their back, in a crib or bassinet. Alone means no blankets, no pillows, no stuffed animals, and no crib bumpers. All your baby needs is a fitted sheet. On their back means you should always place your baby on their back to sleep, for every sleep, naps, and nighttime. This significantly reduces the risk of SIDS. And a crib, bassinet, or play yard that meets current safety standards is the safest place for them. Room sharing, where the baby's crib is in your room, is recommended for at least the first 6 months, but bed sharing is not. A swaddle can also be a new parent's best friend. It mimics the snug feeling of the womb and can help calm a fussy baby and prevent their startle reflex from waking them up. Just make sure it's snug but not too tight, and stop swaddling once they show signs of rolling over. Okay, let's tackle diaper duty. You are going to become a diaper-changing champion, I promise. Newborns can go through 8 to 12 diapers a day, so you'll get plenty of practice. Before you start, get your station ready. A clean diaper, wipes, and diaper cream if needed. This prevents you from having to leave your baby unattended on the changing table. Always wipe from front to back, especially for baby girls, to prevent infections. Diaper rash is common, but you can help prevent it by changing diapers frequently and as soon as they're wet or soiled. Let their skin air dry for a few moments before putting on a fresh diaper. If a rash does appear, a good zinc oxide cream can create a barrier to protect the skin. If it doesn't improve in a couple of days or looks severe, it's always a good idea to check in with your pediatrician. Next on our list is bath time. Unlike diaper changes, you don't need to bathe your baby every day. 2 to 3 times a week is plenty, as too much bathing can dry out their delicate skin. Until their umbilical cord stump falls off and, for circumcised boys, the area has healed, you'll stick to sponge baths. You just need a warm, flat surface, a basin of warm water, a soft washcloth, and a gentle baby-safe soap. Once you get the green light for tub baths, you can use a small baby tub. Always check the water temperature with your wrist or elbow to make sure it's comfortably warm, not hot. Never, ever leave your baby unattended in the water, not even for a second. Keep one hand on them at all times. Bath time can be a wonderful bonding experience, so sing songs, talk to them, and enjoy those sweet, splashy moments. Speaking of bonding, this is one of the most joyful parts of having a newborn. Your baby has been listening to your voice for months, and now they get to connect it with your touch and your face. Skin-to-skin contact is incredibly powerful. Just placing your baby, wearing only a diaper, directly onto your bare chest has amazing benefits. It can help regulate their heart rate, breathing, and temperature, and it releases hormones that promote bonding for both you and your baby. It's not just for moms either. Dads and partners should definitely get in on the skin-to-skin snuggles. Talk, sing, and read to your baby, even if they don't understand the words. Your voice is soothing and familiar. Make eye contact when they're alert and in a quiet state. This is how they begin to learn about communication and connection. Let's quickly touch on some other newborn quirks you might notice. Sneezing, hiccuping, and jerky movements are all totally normal. Their nervous systems are still maturing. You might also see baby acne or peeling skin, which is just their body adjusting to life outside the womb. And what about that little stump of an umbilical cord? Your job is to keep it clean and dry. Fold the top of the diaper down so it's not rubbing against it. It will usually fall off on its own within 1 to 3 weeks. Resist the urge to pull it off, even if it's just hanging by a thread. After it falls off, you might see a little spot of blood, which is normal. But if you notice any signs of infection, like redness, swelling, or smelly discharge, call your doctor. Finally, and this is maybe the most important tip of all, take care of yourself. You cannot pour from an empty cup. The newborn phase is a marathon, not a sprint. It's okay to feel tired, emotional, and overwhelmed. The baby blues are very real, and it's important to talk about it. If those feelings persist or feel severe, please reach out to your doctor, a therapist, or a trusted friend. Postpartum depression and anxiety are treatable, and getting help is a sign of strength. Accept help when it's offered. If someone wants to bring you a meal, hold the baby while you shower, or run an errand, say yes. Sleep when the baby sleeps. I know you've heard it a million times, but it's true. The laundry can wait. Your recovery and well-being are a priority. Be kind to yourself and your partner. You're a team, navigating this new adventure together. Give each other grace. So there you have it, a crash course in newborn routines and baby care. Remember, you don't have to be a perfect parent, just a loving one. Every baby is unique, and you'll quickly learn what works best for your family. Trust your instincts, they're usually right. You are the expert on your baby. I hope these tips help you feel more confident as you begin this incredible journey. You're doing an amazing job. If you found this video helpful, please give it a thumbs up, and don't forget to subscribe for more content for new parents. Drop any questions you have in the comments below. I love hearing from you all. Thanks for watching, and I'll see you in the next one.